Hi everybody. Today we're talking about teenage anxiety. There are a lot of demands on teenagers nowadays. The academics, the athletics, the social pressures, and some kids are able to manage better than others, just like certain adults can manage better than others. And today I wanted to talk specifically about neurofeedback and how neurofeedback can help with anxiety. You know, I've talked to you before about how the brain is supposed to shift gears, right? Speed up to learn something new, slow down when we want it to go to sleep, and then stay in kind of an idle gear when we're doing things that are routine. When kids get stuck in this anxiety, what happens is that they get stuck in these higher gears. It's called beta waves, and this is why they may not sleep as well as they should, or why they just have that constant angst. And this is really, really important to address. I hear more and more cases of teenagers finding other ways to deal with their anxiety, whether it be drugs, alcohol, cutting. I mean, I've heard so many challenges, and this is a non-invasive way to really help your kids get the help that they need. This is a tool that we can use. Neurofeedback helps to train their brain to have a different pattern. So instead of being revved up, we're rewarding the brain every time it slows down. And what greater gift can you give your kids but the ability to self-regulate themselves, right? You know, if this prolongs, then they find other ways to make themselves feel better, and it's not always the best choices. And we know that the prefrontal cortex, which is the front of the brain, really develops while we're in our teenagehood, you know? And so without that development, they're not able to inhibit their brain the way it should. So in other words, they might make impulsive decisions. And this impulsivity can really create lots of challenges for the whole family dynamic. So my suggestion is, if you have a child that's struggling with anxiety, don't wait for these other things to pop up. Address it now, address it at the source, and get a QEEG so that we can see if that's what's going on with them. Thanks for listening. Talk soon. Bye.